And most times when I listen to news, you ask people and they were being asked where they get their drugs. They say they get it from chemists, not pharmacy. So that professional part of it, image, is obscured behind these things. So I'll go back to organization and regulatory changes we need to make. One, we need to update our curriculum. It is not enough for us to say we can offer immunization. Yes, pharmacists do work in supporting enough to say I can do it. We require a kind of backing, a legal framework that will say pharmacists can do it. It will involve some form of certification because we all know that the curriculum, I don't know in the last 10 years after I left school, if we have, for example, been involved in school in immunization. Yes, we take courses that mentions immunization. So we need to bring legal backing through our regulatory agencies, and particularly the Pharmacists Council. I do know that the ACPN is working in this line, and it is the right way to go. WHO in the European Union has supported pharmacies and pharmacist professionals to develop a legal framework that gave them the backing. And this allows for accountability. Because as a professional, if I am going to be involved in immunization, there are accountability framework that I need to fulfill. There are minimum standards that will, I'm sure Dr. Metometi will be talking much on this, that we need to meet up on. There are minimum skills that we need to achieve. Because even in immunization, we require professional indemnity. Is that well defined now? So we need to show to MPACDA, for example, and to the ministry, what we are bringing to board, what gives us the backing to do that, what our curriculum in school has offered and prepared us to do it, even when we are doing it now, but already we do not have those backing. So the first thing to start is that part of a regulatory framework for what we aspire to do or what we are doing. Because in the event of mishaps, we need to have a legal backing to what we are doing. So when we started this and ACPN involvement, I told the national chairman that this is not too late. But when we are talking about this current pandemic, we may have to do a catch up. We should have started like 10 years ago, but it's never too late to start. I do know MPACDA has received our submission and is being reviewed. How willing people are ready to do it. Imagine if it's a pharmacist like uh, our good mother, Pharmacist Awoshika, that is now the head of MPACDA. We have an in-role. So deliberately, we need to prepare ourselves as an organization, as professionals, for people to occupy the right place because of what we want to achieve. We sit too much in our pharmacies, whether in the community or in the hospital. We do not take care early enough of our environment. We do not countenance with it. So under the organization, I would like to stop at that. But the summary is that we need regulatory framework. We need to update our curriculum. We need to organize even updates for people to be able to cash up. We need to have certifications for people to say, yes, I can do it because I have been trained and I have a certificate to back up that I can do that. Otherwise, people will see us coming into this venture because of the economic gains. They will not see it as something we have to offer as a professional. And you don't blame them. The world is about competition. What you have to offer, you must be skilled in it and of legal. Our regulatory activities, if you have, must be upscaled. Do we have adequate regulatory monitoring and evaluation system that can say we are sure of what our pharmacists are offering out there? Are we as professionals also ready to provide these services as professionals? And that brings me to one point. We have to see it as services. We have to downplay the incentive part of it. It will come naturally. But if I go to a meeting with the heads of ACPN, PSN, Pharmacists Affairs, and in the first meeting, what you are raising is about how pharmacists can make money from this. Even when I know that that is true, even when I know that other professionals are being paid for this, I can use that against you, that you were just not interested in the services, but the funding that will come. And I don't want to be misquoted. This will come naturally for every service that any professional offer. There must be a corresponding remuneration, but that should not be the primary thing that will push. Because even before now, we've been offering services to our community. We do not take consultancy fee like some people will do. I talked to one of my cousins. When you go to her office, she's a lawyer, and you are talking, even on phone, you are talking to her. She will ask you, let's meet in my office. It's because she wants to document and collect service. I mean, a fee for that service from you. We do not do that. And that is the public health perspective part of it. But if we have a legal backing, the legal backing will come with the aspect of the remuneration. Engagement, involvement in our community is one of our strongholds that we have to downplay. Pharmacies or pharmacists in community should know that community very well. In fact, should know who gave birth in the last 7 days and they are yet to come and take vaccination. Should remember that I've not seen that old woman that comes to buy anti-diabetes from me and find out what is happening. These are not difficult things to do in this age. We must leverage on technology for in some climes, even when that family, the firstborn is going to university, the pharmacist can send a message and ask her after the boy is doing. That brings loyalty to the service and it's seen as an elder in that community. So we need to upscale that very well. Somebody may ask me, is the clinic down the road doing that?
I hear you again, sir.
Hello, Farm Amzad. All right, distinguished colleagues, I'm sure we have followed the Pharmacist Amzat's submission. He had given us some very critical nuggets as to if we as pharmacists want to play in the field of primary health care. There are a few things we need to put in place, first and foremost. And among these is the need for us to rebrand. There is that need for professional image, perspective. We need to present ourselves appropriately to our community. You also mentioned the need for updating our school curriculum to prepare our pharmacy students right from the school for the task ahead. He has also talked about the very need for legal framework backing on vaccination so that if anything happens, we'll be covered legally if anything goes wrong. He talked about the need for professional indemnity, which also will take care of the risk that might come on during our work, at our workplace. He talked about the need to have a regulatory framework. Importantly, he talked about the need for monitoring and evaluation system to be put in place. The very need for documentary ability by pharmacists. I know a lot of us are a bit not comfortable with documenting, and whatever is not documented is not done. So a lot of them might have to start doing the needful. Also, he emphasized the need to downplay incentives for now at the early stage. We should first and foremost get in, and then when we get in and then play up the service delivery as our key point, that naturally the incentives will follow. And finally, he mentioned the need for us to get more involved in our various community. We must be part and parcel, an integral part of the community where we practice, so that we'll be seen as part of them. So Pharmacist Amzat, we thank you so much. We'll come back to you during the question and answer session. We'll move on to our brother and friend in the diaspora to give us some few angle into what obtains over there in the US. We are aware that for over 20 years now, pharmacists in the US have been given the flu vaccine conveniently, and that with the current COVID surge, our community pharmacists over there are being mobilized extensively to hit the target of the government. So pharmacist Dr. Kunle Tometi, kindly share with us how did you guys got to that point, and then what can we learn from you? Thank you.
Good morning, and thank you very much. Every time I have the privilege to join a Zoom conference or attend a live conference in Nigeria, I marvel sometimes at how people think that I bring a wealth of knowledge. On my end, I actually believe I learn a lot attending these conferences or the Zoom. The nuggets that Pharmacist Amzat has shared this morning was eye-opening to me, and it's another layer of things I've learned. And this morning, I wasn't really sure what I was speaking to, but I thank you, Gio, for redirecting. Yes, in America, we pharmacists play a very important role in public health. We are, in fact, the end of the value chain in the healthcare sector between the healthcare practitioners and the patient. Everything stops at the buck of the pharmacist. No matter how much program, how much energy, how much intellect is put into a program, if it does not have pharmacists as part of the program, it will be pretty difficult to execute. Pharmacists are very, very plenty in number in this country. Most people, whether in the urban or in the rural areas, live within two kilometers to a pharmacy. And it's not unusual to see pharmacies here running and filling 3,000 prescriptions a day. Not because the people are drug seeking, but it is the way the health system is set up that you really cannot get any medicine without a prescription. What are the values that pharmacists play? Pharmacists are very knowledgeable. I was telling my colleagues that the pharmacy curriculum in America has been PharmD for a long time. At the moment, I don't think there's any pharmacy school offering a bachelor's degree anymore. The curriculum of attaining a PharmD degree here is so extensive. You do the basic sciences, which is mostly what we do in pharmacy school in Nigeria. You do some professional work like compounding, but it has now been upgraded to include things like epidemiology, things like pathophysiology, things like advocacy. A whole lot of things has been added into the education to the point that when you're done, you're so very rounded, and it's no mean feat at all to wear the title doctor, because in fact, you are more than ready to engage with any member of the health sector at a professional and at a very high educational level, because you've been exposed to all of those. So pharmacists are knowledgeable. It's not atypical that patients, even here in America, seek the attention of a pharmacist first before they go to a clinic or go to a hospital. So at every point in time, you are challenged as a pharmacist to keep abreast of information, to keep abreast of new development, to keep abreast of changes in regulation, to keep abreast of politics. Another thing about pharmacists here is we are very affordable in the sense that when you go see a pharmacist, you don't need an appointment. You don't have to pay any consultation fee. And pharmacists are very readily available to discuss and help patients find solutions to the opportunities that they present. Pharmacists participate a lot in healthcare programs here. We help people manage their diseases, chronic diseases are met. We do cholesterol testing here. We measure blood pressure. We measure blood sugar. In my place, I actually do INR testing to work with cardiologists that are close to me. So all of this testing that we do, we help people stay on their medicines, to be compliant, to give them the better outcome, and help with the practitioners in adjusting and changing medicines as and when needed. Now, there are other things we do here as pharmacists. We provide leadership. A whole lot of us work in leadership positions. Hardly would you find a big pharmacy conglomerate where you don't have pharmacists at the top of the leadership. I used to work for CVS Pharmacy. CVS has about 15,000 pharmacies in America. They have working for them at least 500,000 pharmacists. But in the board of CVS at the top level, over the last 20 years, I've had relationships with those guys. The president of the company has always been a pharmacist. So pharmacists, we work in very, very top positions in leadership. Pharmacists here, we put together money, we put together people to make sure that we have pharmacists in our House of Representatives, in our Senate. All politics for us is local. We have to affect things locally. So we put people in positions here. We put people at boards of pharmacy. We put people everywhere where we know that matters will be discussed. Because if you're not on the table, you are in fact in the menu. We don't want to be in the menu where people will dice and eat anything that concerns us. Rather, we want to be at the table advising and assuring that what concerns us really. Now, in order to be relevant, I think it was He was Chief Adelusi Adelu on his 80th birthday. He did say this, and I remember, in order to be relevant, you need to show your value. Just like Dr. Amzat said earlier, pharmacists have to do things in the community to show their value. It's because of the way we present ourselves sometimes that projecting a different image of what we truly are, the knowledge, the knowledge that we have, the skills that we have, we're not showing that in a differential manner from the people that compete with us. Over here, pharmacists are very highly regarded because of the way we carry ourselves. There's always been a poll conducted every year for the most trusted profession. And pharmacists have always been number one or number two of all professions that are polled. Lawyers are often the last. Now, in order for us to look at how do we make ourselves relevant, we should be looking at a few areas. For example, in the community that we live in, we should connect to the local government offices, as in Nigeria. We should have access to the local government chairman, who some of us here really don't know who is in charge of healthcare affairs in the local government that we live in. We should really plug in and be able to connect to the leadership there and know what is it that they are needing in terms of healthcare, and pharmacists should be ready to lead all of those efforts. We should participate with the local government in healthcare campaign. Simple things like diabetes education, like hypertension, like HIV. We should be forefront and leaders in that, creating banners and leading TV appearances and making sure that our community, as we say in Nigeria, every politics is local. You must win your ward for you to do anything nationally. That is how it should also be for us in our profession. Wherever we live, the leadership of that community must know us as pharmacists. And when there's a need for anything in healthcare or pharmacy, they know who to go to. Another thing that we can do, I think Pharmacist Amzat or the other gentleman who work in WHO can address this. Just because the world has moved on to clean and affordable water and sanitation, more than 80% of most communicable diseases have been eradicated. Here we have pharmacists that work in cities, that work with the agencies that control water and water distribution. They work with agencies that control simple things as sewages. We need to encourage our pharmacists to try to think out of the box and start working in consonance with people and things that really affects our community. In our stores, we can help with patient compliance in their medicines. We can send reminder calls, because a healthy community, in fact, is a healthy country. We can perform drug utilization review. We can look at the patient profile. How often are you taking this medicine? It was for 30 days. You're coming back after 90 days. That means you're not following directions. We can perform ADRs. A patient comes to you, oh, I got this medicine yesterday. I'm lodipine 10 milligrams. I've not been able to sleep. I'm getting flushed. Is it possible that the dose is too high? Is it possible that this patient is not compatible with channel calcium blockers and we need to move them elsewhere? We have all the knowledge to do this. We can work in our community doing HIV screening. We can help working with organizations that distribute ART. There are many things we can do in the community. Example, we can partner with SFH. I think I was a young pharmacist when that organization came to Nigeria. Work with them in reproductive health. If you have young couple coming into your pharmacy, they're trying to get on contraceptives, and this patient, young, they're thinking of compliance, we have an opportunity to educate them about depot preparations. You may have a young couple, say mental health, for instance, that you know this person is prone to suicide. Why are you, as a pharmacist, not working with the local mental health hospital to educate them about not dispensing a lorry load of tricyclic antidepressants, knowing now that we have better drugs in the SSRI, and we have better drugs that are a whole lot less side effect and are more effective. We may have a young lady who is depressed, want an antidepressant, and the mental health practitioner is trying to put her on simple things that will affect libido, will affect our chances of getting pregnant. You can step in as a pharmacist and educate that whole community about the best things and best medications to prescribe. I mean, the COVID-19 pandemic, when it came, everybody, including their brothers and sisters, started making hand sanitizer gel. We seem to forget that one of the areas of pharmacy practice that even the chemists in Nigeria cannot venture to is compounding. We have that skill. It is a particular skill taught only to pharmacists and pharmacist students. They don't teach that in medicine. They don't teach it anywhere else. We need to showcase that. It was gladly to my heart that every pharmacist in every area was quick to manufacture hand sanitizer gel and take it to authorities. I think during that time, pharmacists were highly recognized for the role they play. So we should not forget that art to differentiate us from everybody. Now, the very common thing we're doing now because of the pandemic is vaccinations. Pharmacists are well-trained. Pharmacists are certified. I cannot run away from the fact that as an operations professional, as a leader and as a manager, yes, the money part is important because we've got to balance the books and we've got to see if at all it's profitable for us to even participate. And indeed it is. It is very rewarding as a service, as a pharmacist, that you can help your community get healthier. You can help protect your community against diseases. Like Hamzat said, there are many steps we have to take. Regulatory, who is going to control that? We need to be working with the PCN and we need to work with the NUC. How are we going to incorporate that into the curriculum of the pharmacy schools so that when pharmacists graduate, they already have that skill, train them, and they don't need any extra certificate because it is included in their curriculum pertaining to a PharmD degree. We also need to partner with people in order to make this come to pass because we cannot work in silos. We have to partner with the NMA. I know there's a rancor between the NMA and the PSN, but like I would say, some of these people, we went to school with them. We stayed in the same hall with them, in the same room. I remember in Ife, I went to Moza with most of those people. And up till now, I maintain great relationship individually with each of them. And I would admonish all of us that we should try and build collaborative working agreements with practitioners, with lab scientists, with anybody who is involved in the management of care of the patient. It may not happen at the professional and higher level of the NMA and PSN, but you can use your relationship that you developed years past. These guys, you go to church with them, you go to mosque with them, your children attend the same school. Try and build that relationship at that level. And the most important part is the political will. How many pharmacists are in the legislative arm of government? How many pharmacists are in the administrative arm? We should encourage our people to take those positions because no matter how much we put effort into getting all these things ready, if there's no political will and zeal to push it forward, we may not be able to actualize them. And I thank you very much for your time. Sorry, I've taken so much of your time. Thank you.
Thank you so much, Dr. Tometi. You have given us a lot of perspective as what of things over there. And Nigeria cannot be a standalone country. A lot of takeaway from your submission. You, of course, emphasize the need for pharmacists to get involved again, just like what the pharmacist have talked about. Get involved with the community. We need to show our relevance. And lastly, among so many other things you talked about, you talked about the need for us to get into politics. I mean, this is where policies are made that affect our various practices. And we cannot be saying that politics is dirty or is not meant for us, while we leave it for others who will now legislate over our various activities. And rather than being, ready, we become reactive. So please kindly keep your questions. I can see hands being raised. We get to the question and answer once you have taken the last speaker. And when you talk about the politician, we have a politician to speak to us right now, a politician pharmacist, who incidentally has been the head of the House Committee on Health. He has headed that committee, Osun State, and currently he heads the Primary Health Care Board in the state of Osun. So, Pharmacist Honorable Leke, we need Leke Ogunsola, we need your perspective on the subject matter. You have gotten to the top of our discourse as you are heading the primary health care of the state of Osun. How can we have it nationwide? What are the magic that you did to get to where you are? Share this with us, and what are the challenges and the way to go about it? You have the floor, sir. Pharmacist Honorable Leke Ogunsola.
Well, I'm very happy to be here, and I thank the Pharmacists Affairs for this wonderful opportunity. I hope you can hear me.
You're welcome, sir. We can hear you.
Thank you very much.
If we can see your face.
Hello?
If we can see your face just a little bit.
A little bit. Okay. Sorry.
And then you can go off.
Oh, sorry. If the video will affect your audio,
okay.
You can put off the video, sir.
Which is,
okay.
You can see my face. Thank you very much. Can you see me now?
No, we can't see you. Not just for a little bit, then you can turn it off.
Okay. I thank you very much. I want to, opine, it is very important for us to go into the nitty-gritty of politics in order to advance our profession. Like I've shared before, in the state of Osun, it was when I became the honorable member, my first tenure, because I was in the House for 2 terms, 8 years. It was during my first tenure that I found out that it's only one profession that was heading or becoming the administrative head of the Health Management Board. I mean, that's where you have all our practitioners on the field. It is that board that supervises all our hospitals, both comprehensive and the secondary tiers. Well, when I saw it, I now had to go into it to see why is it that other professions, more importantly my own profession, which I know is ably qualified to become the permanent secretary of that kind of agency. And I had to talk it out with the then governor, and we devised a means which I may not be able to tell you here. And that produced the first permanent secretary of health that's heading the Health Management Board. And my experience so far shows that the training that we received as pharmacists has really prepared us to be the best among any area that we venture into, more importantly in politics. And I can tell you that now, even before I left the house, 2 weeks before I left the house, they saw what I did when I was the chairman of the Committee on Health. And 2 weeks before, we were to rehabilitate 1 per ward of our primary health care. And the new governor thought it wise that because of what he has seen me doing and what I have done, even for the system in the past, I should be the one to head that committee. The committee is called Committee on Monitoring and Implementation. And that is the main committee that to provide the rehabilitation of 332 primary to enjoy wherever we find ourselves. More importantly, we must put in all our best. Let's parade the training that we receive. And that has helped me a lot. And like I used to tell people, while I was the rest of my words, I kept on improving education, so that even there was the day that the Nigerian Medical Association came visiting the house, and that it was that was dealing with them. All that they thought that they are the only one that could parade it. I did my best to show them that we are best prepared as a member of the health team to be able to steer the ship of that system. And also, let me bring in that integrity matters, and do not let us look at the material gain in politics. If you go in there to look for the material gain, you will not be focused, and before you know it, you will have put your profession into disrepute. So what I did each time was to make sure that I do not put material gain ahead of anything in my partisan politicking. And also, if you get to my agency now, you would not believe what we have done in the little time that I've spent. The executive chairman of Development Agency and as a pharmacist. And John also, right now we are in the era of vaccination, and I have my teams in all the local government. Unfortunately, in Nigeria, it's a pity that our pharmacies have not been considered to be a vac center or a vac site. Ordinarily, in the advanced economies now, you find out that several thousand vac sites. What I mean by vac sites are vac, and the pharmacists are the one that are playing the main role in this area. So I want to advance the leadership of the profession in Nigeria. Let us have a way by which we will interact, more importantly, with politicians, because whatever we do, it is the politicians that would dictate what the result will be. And because we run democracy, if you look at our constitution, you find out that the head of any agency under democratic dispensation will be a politician. And a politician can change even within the space of a 4-year tenure. It can change things that have not been able to come around in a century. So, the leadership to please come on board. Try to pay and go around it. The system. It is a different, was not stoop to learn. You will never become a successful politician, even if you have a first class in any area of your advancement. So what I want to advise is that from the local to the national level of leadership, let us try as much as possible to embrace positively the political heads each time they come on board. I want to thank the National PSN for encouraging pharmacists that come out to contest elections. This one will go a long way to help us and to allow more people to come into politicking, because we need ourselves. And when we get there, we will not forget those people, because in politics, what you remember most are those people with whom you work together to get to where you are. So, and I want to advise many of us as pharmacists, let us come into partisan politicking. Let us come on board. It will help us a lot. Yes, it is a very tough and a ground that we can never foretell what can. If can, if we just come out first, don't think about the bad side of mobility into the system. I want to thank you so much. If there's any other thing that you want me to do, there are a lot of other things that we may not be able to say on the kind of this platform, but which, if we mix, like I said earlier on, with the leadership, we'll discuss. And I'm very, very sure it will be well for our profession and the practice as a whole. Thank you so much.
Yeah, thank you very much, Honorable Leke Ogunsola, for those that beautiful submission. Again, the need for more of us to get involved in politics has been re-emphasized, and it's a clarion call for some of us who probably have the liver to begin to get into the ring. So thank you so much, our three speakers, for the very nice deliveries. The floor is now open for question and answer. We take a few, one directly. Then for those who we cannot take, kindly write it down so that it will be read out. I can see the hands of pharmacist Dr. Additional Afsat up. Can you unmute and ask your question, please? Kindly unmute and ask your question.
Yes, good afternoon. It has been a very wonderful, yes. Hello, can you hear me? Can you hear me, please?
Yes, go ahead.
Yes, yes, it has been a wonderful, it has been a very, very wonderful presentation. And I want to just find out, I know there are a lot of public health activities going on every other places. And I remember in the day of NPI, pharmacists were involved in some of the immunizations. A straight question I just want to ask the Honorable is, in Osun State, could it have been possible for you, sir, to influence one or two community pharmacies to participate in the vaccine without being questioned, sir? Just like as they are Untitled Affairs, could you have been able to put, or is it possible to use one or two community pharmacies as outlets for the vaccine immunization in collaboration with maybe a PHC or so. Thank you, and over.
Okay, over to you, Honorable.
We can take other questions so that when he's back, we can relate to him.
Okay, let's take all the questions together. Please raise your hand and then we will call you to ask your questions.
Complete and direct.
Do we conclude that the presentation was so good that we don't have any question for the speakers?
Was that did not finish?
Questions, House? Okay, I can see Pharmacist Ugo Chris. Please ask your question. Or mute and ask your question, please. Pharmacist Ugo Christopher, or mute and ask your question. Pharmacist Kayode Aigbajeje.
Yes.
Hello.
Hello.
Unmute yourself and ask your question.
Hello. I've unmuted myself now.
Hello. Good afternoon. Thank you so much
Hear
for
you,
the lectures. Sorry, am I on or somebody else is taking?
Yeah, okay, you can go on. Pharmacist Ugo, please hold on.
Okay, thank you. The next person will wait.
Yeah, I want to emphasize the fact here. I'm very grateful for this webinar taking off, and once again, thanks to Dr. Kunle Tometi for being part of it. We've learned a lot from him. Well, the issue of pharmacists being underutilized, I'm seeing it on the charts, and I think we should all come out here and praise Lagos State, because Lagos State is way, way above even the federal and all the states. I remember when I was heading one of the hospitals, as head of department of the pharmacy department, I had 9 pharmacists under me. And then we had a happy-end conference, I think it was in Calabar, and the whole of the state did not have up to 9 pharmacists. And I, in just one hospital, had 9 under me. And so that is one part. The other part is that in Lagos State, all the primary health centers have everything about the drugs under the pharmacist. You have pharmacists supervising some of them, and so you have pharmacy technicians that man the place. But in some of them, pharmacists are actually working in those places. So we've been expanding the roles of pharmacists in Lagos State, but the federal and the other states are just not catching up. That's how the healthcare in Nigeria is better practiced in Lagos State than any other place. And even the doctors here in Lagos also are in that. But we face each other, we quarrel, we argue, we do everything. Pharmacists still have their ways. We fight, it's difficult, but we still get it somehow. Why can't other states get that? And how can we get the federal to do that? Lagos State is setting the pace. We're not just say go for show for nothing. So let's get something at federal done and let other states, we can learn from each other. You can learn from Lagos State, how is that done and stuff like that. Thank you. Thank you, I'm over.
Thank you, Pharmacist Christopher Uku, you can go ahead now.
Okay, thank you very much. I very appreciate the effort, the Pharmacy Affairs, the opportunity given to us to hear from my very senior colleagues and how well pharmacy profession is doing globally. I'm most impressed by the last person that spoke in. He said, not that I don't like others, but that's where I feel that in Nigeria we are lagging behind the most in the issue of pharmacists in politics and level of involvement of pharmacists in politics. And I still believe that that's the be a very great way forward. But my view, I want to ask the honorable, in what way? Because I know quite fine the level of involvement in party politics and money being involved in politics. Please, how can you advise? Because most of our colleagues, you see, some of us, they even come from overseas, coming down home to involve themselves in politics. Sometimes they spend their money, they couldn't get anything, and they get back. Please, what way out does that help us? Some of us that would like to get ourselves involved in politics. The best way to soften the ground in the sense that it can, at least can easily be accepted. Involving because party politics this time around, if I'm sometimes involved, the region where you are, APC may be running here, PDP might be running the other side. In what way best will you encourage us to at least to ensure that we start? Because some of us, like, okay, you want to go to House of Rep, they'll tell you, okay, you would have gone through councillorship or been embracing some grant, what do you call it, the sponsors. So I need a level of encouragement from inside to know what best way forward to ensure that at least I dabble into politics and I will not have my fingers or my initiative being burnt like that. Thank you very much, the Pharmacy Affair, for this opportunity.
Thank you, Pharmacist
Thank you.
Christopher Ugu. I'm sure your question is taken note by Honorable Leke Ogunsola. Pharmacist Nelson,
thank
Ukor,
you, my
please,
honorable
unmute and
Oga.
ask your question.
Pharmacist Nelson Ukor, please, you have the floor.
Okay, good evening, my concerns. I hope everyone can hear me.
Yes.
Go ahead.
Okay, great.
Can hear you.
Thank you very much for the opportunity to ask this question. The session has been really engaging. But then I would also want to ask in terms of pharmacies, community pharmacies offering vaccination services. Because presently, in the past, I worked with a community pharmacy that leveraged using community healthcare workers as vaccinators within the pharmacy. So that way, community pharmacy was able to offer this service. I want to know, since legislation probably precludes pharmacies from directly vaccinating now, can that be leveraged as an opportunity to still use community pharmacies as centers for vaccination within the rural communities around Nigeria? So I wanted to see if that is a viable opportunity to have pharmacies more involved in vaccination, even if we can't give directly because of legislation, if that can be an avenue that can be used. Thank you.
All right, thank you. I thought I saw Dr. Lolu Ojo's hand.
Dr. Lolu Ojo, you have the floor.
Dr. Lolu Ojo, please. It's like he has dropped his hand. Dr. CG Olamijulo, Honorable, that's another politician pharmacist from the state of Osun. Can you unmute and ask your question, sir? Like the hand has gone down. Do we have any more questions before we take a response from our speakers? Okay, speakers, please. You can take the question that most affect you and help us to share some light on it. Pharmacist Hamzat, maybe you can go first, to be followed by Dr. Tometi, and then finally, Honorable Ogunsola.
Thank you, my boss. I do not have any question that relates directly to me, but I think because I dropped off, no thanks to internet services here, I would rather want to add something because most of the things I have, actually, the two speakers mentioned them. But to respond, I would say one, we need to evolve, in summary, from being dispensers to primary healthcare professionals. Somebody was asking, can we use community extension workers in our pharmacy? That can be a starting point, but that should not be our end point. The idea is to get pharmacists to do this, and there accountability becomes priority because we know we are doing what we can do as professionals, not leveraging on. We could employ the services of healthcare extension worker, but the agenda should be let the government recognize that we can offer that service within a legal framework. Two, we should also evolve from being suppliers of medicines to professionals who care about access to health care. Because when we talk about, for example, our but that we have the capacity to also take care of adverse events following immunization. As we were talking, somebody sent an SMS, a message to me, and was saying that in life you get what you are, not what you want. If you ask me now, well, in Nigeria, what we want are the things we are talking about. But who are we? And that comes back to my discussion on we need to have the legal framework to back what we are talking about. Somebody on the chat also talked about getting into the kitchen, and I like that very well. We have to be involved. How do we get involved? And there I will take ACPN to task. Good, we've made proposal and submitted to MPACDA. We need to consistently follow up. At the least, we should negotiate. For example, can we get a few pharmacies onto the vaccination program now? Maybe not more than 3 states, but with a balance in each state of a rural and urban distribution. If we can do that without expecting, because this is just an investment from our part, as far as I'm concerned, have a good documentation of what happened in those pharmacies, including interviewing the participants, the clients that will be receiving vaccination from there, about their experience on getting vaccination, and show this. The second option is, as ACPN, can we put funds together to have a pilot on our role on primary health care and have this widely publicized? These are evidences we will need to negotiate or to lobby from our politicians. Because even if we have members in Senate, in House of Rep, and also inside Aso Rock, we need evidence to show what we can do. Remember, I said it is not enough for us to say we can, but do we have the legal backing? So we need to run with that also and ensure that we have that. With this, I would like to say this, to thank the organizers of this program. I hope we continue to have discussion like this. This is doable because it is the right thing to do if people are talking about universal health coverage. And incidentally, Nigeria adopts primary health care revitalization. And revitalization is more than the structures, if you look at that document, as our own road to universal health coverage. And it also includes the engagement of the private sector, which we belong to mostly. I want to round up by following on what Dr. Tometi, one of the things he talked about us being able to provide services. One of our colleagues is in one of the satellite towns in Abuja. At the heat of the pandemic last year, with the lockdown, hospitals were looking for hand sanitizers. And she told the medical director in that hospital, I can prepare this. This is what I need. the medical director, a lady, reluctantly accepted. But if you meet that medical director now, she speaks so high about that pharmacist. She thinks he's a wonder because in that hospital they had challenges with healthcare infection prevention and control. And that hand sanitizer the colleague was producing came very handy to the extent that this spread to the other hospitals. And most of the hospitals in Abuja, the secondary level hospitals, are producing hand sanitizer, extemporaneous, and that is being used in the hospital by the healthcare workers. People also come from outside to procure from them. So the demonstration of what I can do argues better for me is evidence that we need to present. So if we think MPACDA or any government organization will just wake up today and say, oh, pharmacists should go ahead and do this. Sorry, it's a joke. There are a lot of competing priorities that people are looking forward to make their gains from. So for our profession to make gains from this and also to serve humanity, which we are trained to do, I think we need to be consistent and also target beyond this current vaccination for the challenge we have now. Because the truth is that COVID-19 to me appears to be going to be around for a long while. We do not know how long the vaccines will even protect us. So it might come to the level that it will become like the flu jab that they get in the US. So the long-term plan we need to put in place to get involved in this. Once we demonstrate our presence and our professionalism and the cost effectiveness of using pharmacists in doing this, people will eventually come along. So I encourage ACPN to continue on this path and to continue to lobby with all possible supporters of pharmacy or friends of pharmacy. We need to do is to bring MPs, and it is people that we know, the friends that we have, even outside the profession of pharmacy, that can do that for us. Thank you.
Well, if I would just make some comments.
Thank you so much.
Okay. If I can pass some comments, because I have to go to work. My patients have been calling. Dr. Amzat is very right. If you went to Ife in the days I went in the late 80s, there was an erudite professor of pharmaceutics, Professor Gulan. When you sit in his class hoping to learn about microbes, at the end of the day, what you really learn is classics, English. He once defined a profession. I'm sure you remember.
Yeah. That's not fair.
Yes. He tried to define a profession in one of those classes. And that, I can tell you, in my 4 years of pharmaceutics class with him, that's the only thing I remember. He defined a profession as a profession is a conspiracy against the laity. As you do have in church, there's the laity and then there's the clergy. It is the same conundrum we find ourselves here. As pharmacists, we are a profession against everyone, just like everyone is organized against us. Some of the services we want to provide, like Dr. Amzat said, in primary healthcare, vaccinations, those things, those services and that space is currently being occupied by people who are referred to as the laity against us. And whether we can visualize it or we are not able to, at the end of it all, money is involved. At the end of it all, are those people on the other side of our profession willing to give up that stream of income? Are those people going to just lay low and allow us to take over that money-making opportunity for them? Or are they willing to come to the table and negotiate? What can we give to them? What can they give to us? In American vaccination history, I think it started in 1994. And it was really the purview of the medicine and doctors to give vaccination. All of a sudden, there was greater need to vaccinate a ton of people. Childcare vaccinations was lagging behind. And they thought, the best place to do this would probably be pharmacists. The fight continues even until today. Even though 50 states and the 2 territories have licensed pharmacists to vaccinate, there are still some vaccines that pharmacists are still not allowed to give. Up until late last year, if it was not for the COVID, pharmacists were actually barred from vaccinating people younger than 12 years old. So now that the opportunity has met the road, the opportunity here presents itself that there is a bigger gap for vaccinations to be given to the whole populace. Who else can they turn to? Is why the PrEP Act, which is an emergency act that was given by the Secretary of Health, that we can now allow pharmacists, after all they're trained, after all they're qualified, to vaccinate people. We vaccinate people now 3 years and above. So it is a long road of advocacy. You're starting today. You're meeting a ton of roadblocks. It's normal. But as you continue to press, and as you continue to get into the kitchen, like Dr. Dave said, as you continue to put people on the table, rather than leave people at the door, that time will come when we'll be able to reach a point where we can negotiate and get some things for ourselves, and we too will have to give up some things to placate the other people. Here in America, if you, all these big pharmacies, just like in the UK, the Boots Company, those things are corporations. And once you leave the store where the pharmacists practice, above that level, even if a pharmacist ascends to position past that level, like I did at Ukor and CVS, you're no longer talking pharmacy profession. You're talking business now. Mm-hmm. You're just talking business. Yep. It's numbers at that time. As a pharmacist, though you have that degree, you're talking about payroll. You're talking about sales. You're talking about management control expense. You're talking about bonus. You're talking about benefits and emoluments. So we need to have that at the back of our mind, that we pharmacists, we must also educate ourselves on these things that affect the function, proper function and running of our pharmacies, not just to keep bragging everywhere in our heart and in our chest that, oh, I'm the custodian of medicine, I'm the expert. Yes, you are the expert. That's not, no one's arguing that. But what value do you bring to the table? And that is important. I will round up by saying that there is politics in everything, and everything is in politics. The gentleman was asking earlier what advice can be given to him to get into politics. I will tell you that you would have to start with baby steps. In the community where you live at, I'm sure I have a property. I do have a property in Aja area, and we call it homeowners association. Are you involved in that community? You should always make sure wherever you are at, that your voice is heard. Are you involved in your children's school board? Are you involved in your local PSN? Mm-hmm. I'm sure there are more people here on this forum than there will be in some state PSNs when they call meetings. Are you involved in in the people, the delegates that are sent to the national councils. So it's from these small baby steps that you begin to find your connection into politics. Here in pharmacy, I sit on the board in Texas of the Pharmacy Association. In fact, on 2 select committees. There are only 3 of us in the audit committee for the Texas Pharmacy Association. And I'm a Nigerian, but the fact is, you have to put yourself out there. You have to make sure that all these ideas you have, if you keep it within yourself, it just stays within yourself. Sometimes you may not even be the one who will get to the table, but you will have influence on who gets to the table. Sometimes we don't actually have to be the one running the whole organization, but we must get to a point where our ideas are sought out and our ideas are of value. And I will not delay this conversation anymore. I really want to thank you for the opportunity, and God bless us all this weekend. Thank you.
Thank you so
Dr.
much,
Kule,
Dr. Tometi. And finally.
Yes, ma'am. Yes, ma'am, you have a question?
You said you were going to, no, you said you were going, your patients are waiting for you. I just want to appreciate you. We were on the same platform yesterday. Hon Leke Ogunsola.
Oh, yes.
Yes, and you're doing wonderfully well. Cancers, right? So please, I thank you that you have brought up an important aspect that gives me a lot of passion, because I've been a pharmacist in the United States since the year 2000. And I have the passion. I come home every year and I just feel the passion that I need to come back and be more involved in Nigeria with our colleagues. And one thing that I've noticed is that the tension or the anxiety that we want to be like America overnight, it can be frustrating because America is over 240 years old and you did not get there overnight. The fight that we are fighting now, America has gone through it, but it is good that we constantly be on our toes. We are given, pharmacists have been very complacent from what I have observed coming back home. And now they are awakening into the fact that people are stepping on our territory and trying to use up our space. Is making us wake up and smell the coffee and want to be more involved. You won't find pharmacists in politics. You won't find pharmacists at the helm of affairs, but now that people are other professions are trying to use up the space of pharmacists, it is good that we are waking up, and it won't take us 240 something years like America, but it will take us, we're on the right track. And the fact that pharmacists, when you have your B Pharm, it is just like BSc. In America, the first pharmacy is a postgraduate degree. You first have to have a first degree, which is a B Pharm here. And then you go for postgraduate and become a pharmacist. Then you have the Pharm D, which is doctorate. So it's B Pharm in Nigeria is still a step lower than America. And it is important that we are having people like you that come to let us understand and be encouraged in Nigeria, because I know pharmacists in Nigeria will get there. And we are on the right track. And it is encouraging when we have people in politics. So my encouragement is we thank you for coming as part of Pharmacists Affairs Administrative Board of Admin. I want to thank you. Go see your patients. We're almost done. So thank you. And my colleagues that are hearing me, I want us to be encouraged that we're doing the right thing. And when we get there, we need to be in the kitchen. We need to wake up. We need to start taking charge wherever we are. And we need to, to step it up. This immunization would have been really involved if we had waken up in the beginning. But there's still hope, because there are a lot of committees being set up, And pharmacists, they have no choice but to involve us. Thank you very much, colleagues. And that is my own contribution.
It's good.
So we take the last speaker's response, Honorable Leke Ogunsola. Honorable Ogunsola, are you still there? Well, while we wait for Honorable Ogunsola, we have in the house the Director of Pharmaceutical Services, Primary Health Care Board, Lagos State, Pharmacist Adeosun Shakirat. Can you kindly unmute and let's have your contribution, please?
Okay, so good afternoon, everyone. First, I'd like to recognize the presence of the chairman of the State Primary Healthcare Board, all the discussants and participants on this, and a lot that has been a lot of talk about pharmacists not being involved in vaccination. And I would like to look at it at two sides. First, the community pharmacies, we need to look at that area well. And looking at it, the first thing I would say is we need to have a committee, and that committee will be the one that would help us strategize. They would have a framework of, say, about 2 to 3 years. They would go to the drawing board and then have a roadmap. How do we get the pharmacists that are willing to be certified? Yes, we know that 1 or 2 pharmacists have undergone some WHO certification. But if we are going to have pharmacists on board vaccination, then we'll have to look at the number. How many pharmacists are coming on board? How many of them are willing to be trained? We are going to have to collaborate with bodies like WHO and CHI to ensure that they help us certify the pharmacists that are interested. Again, when that is done, we'll have to start to lobby with all these partners about providing solar direct drives in our pharmacies, because we're going to need to store the vaccines. So it's going to be a lot of lobbying and collaboration. We're going to have to move to places like MPHCDA, meet with Dr. Faiza, who happens to be the ED, the Ministry of Health, the Federal Ministry of Health, and lobby them. Now, one thing we need to understand, most times when programs come up and we say that pharmacists are not involved, we need to understand that MPHCDA deals with a country. They look at Nigeria as a country. And by doing that, they look at the most common cadre of officers that you would find around in their facilities. Lagos State is just a center of excellence and is blessed to have pharmacists. You don't have that in most states of the Federation. I recall when the rollouts of registration came up and people were talking, comments had been passed at the back end and people were working on it. Of course, when people started talking, they eventually worked on it and got it sorted. But we need to understand that this would continue to happen because they work with the generic template. So we need to visit MPHCD as a body, PSN, PCN. We have crop of officers, we have crop of professionals that are highly, they are highly cerebral, they are certified, they can do this, they can do that. It's not, and we like Dr. Hamza said, it's not only vaccination space that will organization space. There are so many programs. You see them talking about the patent medicine vendors. These numbers, I don't know if they'll be going to step. So we need to have our people lobbying at these ideas. And the Federal Ministry of Health And for them, and again, with all the partners, WHO, shops, Stops, Chai, so that they would know that when they are working, even those that even work in the private sector, they don't involve us because they don't know us. They may know us, they may have pharmacists in their family, but we are not making ourselves relevant. So we need to get out of our comfort zone. We need to pay continuous courtesy visits to the leadership, especially at primary MPHCDA, so that when they're having any program, they would always remember that there is a cadre that can do something. Now, I've talked about those in the community pharmacies. For community pharmacies, you get to some of these pharmacies and then you don't even find a pharmacist on ground. Okay, I want to get vaccinated. We need to, like I said, we should develop a framework. In developing that framework, we need to also get our members to know that a pharmacist must always be present at these sites, because that means things are going to be done differently. It's no longer the norm where you just have a school start holder dispensing drugs to you. And if you're not careful, you will start to have these school start holders doing the vaccination. So if we are asking that they should recognize us as the professional that we are, then we must be there to provide the service. So these are things that we need to also talk to our members about outside building the competencies. And like I said, it is good as we are making the noise, but as we are making the noise, are we also building competencies? And it's not a one-off thing. Certification, yes, will continue having, we should be having more of webinars that speaks to vaccination. How do you do about it? Physical trainings, very important, so that people would know how to give it. We're not trained in school. So this is something that we need to address. Now, for those of us in public service, as the scheme of service or our job description doesn't allow for us to vaccinate. Now, we would have to, the politicians amongst us will be the ones that will help out in this particular case. As they are speaking to the community pharmacists, then they would have to do the same thing at for the public health pharmacists. In conclusion, I would want to say that we need to continue to lobby our partners. And if we do not lobby our partners right from national, then it will just have been all talks. Thank you very much.
Thank you so much, Farmer Adeosun Shakirat, the DPS of the Primary Health Care Board, Lagos State. Distinguished colleagues, we are almost rounding up, and I need to say that some of the fear expressed by the last speaker is already being taken care of by the leadership of ACPN National. Like when I was laying the foundation for this discourse, I did mention that ACPN has put in place a very powerful multi-sectorial committee to pursue the main agenda of getting community pharmacists in Nigeria into primary healthcare delivery. And a very robust proposal has been submitted to the National Primary Healthcare Development Agency and there is so many subcommittee in that program. And I can reveal to you that some of the experts you have on this platform today most of them are inside that multi-sectoral committee of the ACPN National. So we have started a kind of a road map that will eventually lead us to this end. So discussion will continue. We continue to hear from everybody and then learning from the people who have been there. And then so that at the end of the day, pharmacists in Nigeria too can join the global league and be doing the right thing. Well, for a very last time, I saw Dr. Lulu Ojo again is back in the house. I will give you just 60 seconds, sir, to just unmute and talk, because we have to close this program in the next 5 minutes. Dr. Lulu Ojo, please.
Thank you, my dear brother.
Unmute yourself and speak to us.
I've already done that. Can you hear me?
We can hear him.
Go ahead.
I appreciate you, and I know time is fast spent. What I just want to add briefly, this morning we were at another webinar like this for the hospital and administrative pharmacists, and a lot of discussion. But the key thing is that after this, what happened? I mean, that is the point that I want to put down. Very good talk by virtually all the speaker. But what happened? What's next? I would suggest that the organizers will find a way to put this thing together and possibly get some action, that can really get us value for the time that we have spent for the preparation of our speakers and those that have left many other things to come and join us. Thank you. I appreciate it.
Okay, so Pharmacists Affairs is rounding up. Let's Pharmacist Ladipo, can you please close this session? A vote of thanks from a pharmacist, Titi Onedo.
Good evening, everyone. Once again, it has actually been a very wonderful engagement this evening. And we have learned so much from the erudite speakers on what we as pharmacists can do to make us more visible and more relevant in primary healthcare delivery system. So on this note, on behalf of the Board of Admin of Pharmacists Affairs, I extend a very hearty vote of thanks to our speakers, Pharmacist Leke Ogunsola, FPSN, Pharmacist Omotayo Anzat, Fellow of the West African Postgraduate College of Pharmacists, and Dr. Kunle Tometi, MD Total Pharmacy, Texas, Dallas. We thank you for sparing your time, for coming to honor our invitation extended to you this evening and sharing your thoughts on the role of pharmacists in primary healthcare delivery system. You will all agree with me that the discussion we had this evening had been very robust. We had brilliant and outstanding discussion. And the engagement also has been very thought-provoking, and we have been challenged, just like Dr. Lolu Ojo said, we have been challenged, and I want to assure our speakers and even the participants that it won't just be all talk and no action like we used to have in the past. We are going to swing into action, and all that we have learned today, we are surely going to put into use. And very soon, you will see the results and the results from the what we have learned today. We are definitely going to put this into use. I would also want to thank the participants that joined us today, because if we had called this meeting and we didn't have people to listen to the speakers, there wouldn't have been success made of this event. So I appreciate everyone, the participants, for your patience, for your attention, and the active participation that we have witnessed in this event this evening. And I pray that the Almighty God will continue to strengthen our profession, will go from strength to strength. We thank you very much. And I would want to say we should enjoy the rest of this evening. And I would also want to ask that we make it a date with us next month on another edition of Point Blank. Thank you everyone for coming. God bless you all. Thank you. Over to you, Pam Olubowale. Wale.
The whole day is done. It was a well-spent time. We appreciate everybody for your time and resources in hooking up to be part of this historic discourse. Definitely, all the points raised will be documented and they'll be part of what we also will be submitting to various stakeholders and authorities so that we can push this agenda further. Thank you. And as we await you next month for another scintillating topic, we stay blessed and have a lovely evening and a blessed weekend. Thank you. Thank you. Bye.
Thank you, speakers. God bless you. Happy practice.